In May of 2012, a study was published which begins with these words: delivering compassionate, patient-centered care remains a core value of the medical profession. These words are deeply meaningful to me. I was diagnosed with terminal cancer in the summer of 2010, and one of my greatest gifts and healers has been empathy. The study, Empathy Training for Resident Physician, shows the benefits of a science-based curriculum focusing on the physiology and neurobiology of empathy. Since my diagnosis, I have lived out the truth of this study. When I receive compassion from my doctors and nurses, my immune system is strengthened, thus allowing medical intervention to work more effectively. I attribute the longevity of the chemotherapy not only to its ingenious molecular structure, but also to the kindness afforded me by doctors and nurses who see me both as a patient and also a person who is facing an incurable disease. This empathy is a gift that manifests as a physiological surge of positive energy, which allows me to live my life more fully. Since my diagnosis, I've experienced many versions of empathy. One such version comes when doctors and nurses are willing to articulate the best possible outcome. This lays a pathway in the patient's mind, both consciously and subconsciously. An example of this came directly before the insertion of a catheter when I met with a pre-op nurse. I was haunted by something a doctor said just after my diagnosis, which was my trapped lung could never re-expand. But then I learned that the catheter had a mechanical effect that could help with lung re-expansion. So I said to the nurse, I really want my lung to re-expand. And I was so afraid she would tell me it couldn't happen. Instead, she said, picture your lung re-expanding during the procedure. Because of her empowering words, I could feel a physiological relief so deep that I was freed up to confide what was really on my heart, which was, I want it to be safe for me to be able to fly to see my mother. Without hesitation, she said, I will pray for you. Whether or not we believe in prayer as a spiritual practice, it has, regardless, physiological effects that alleviate tension. Prayer can also be viewed as a way of inviting our minds to envision the ideal outcome. This nurse's level of support went directly to my immune system. When my lung did, in fact, fully re-expand, I knew this nurse was part of that. Her recommendation to picture the body healing in specific ways is a form of treatment that I use daily. I picture my tumor remaining small and safe, surrounded by targeted therapy and my own natural killer cells. I picture the metastasis on my bone is healed, and I picture my healthiest self doing what I most love. When I was struck down with empyema and shivering under 12 blankets, unable to eat or barely move, I would think of this nurse's words, and I would picture myself swimming with the dolphins in beautiful, warm, tropical waters. No matter how sick I was, being able to envision strengthened my morale and my immune system. Yet another way to engender empathy is to extend warmth and human feeling. I will always remember the anesthesiologist who presided over my first surgical procedure, and I have paid tribute to him in an article I wrote for the Annals of Internal Medicine. He introduced himself with the words, So what would you be doing today if you weren't getting a tube put in? Even though I was undergoing stress, I felt happy because I felt a human connection. So I said, well, I live on Revere Beach. I'd be swimming in the ocean. As we talked, I felt a sense of physiological calm. And this is an ideal way to go into surgery. Just prior to being taken to the operating room, the anesthesiologist offered this very caring statement. I know a woman who was diagnosed with lung cancer 5 years ago, and she's doing great. Positive words such as this are beneficial at any time, and especially directly before surgery. The empathy of the anesthesiologist flowed from his recognition of me, not only as a patient, but as a person. He saw the real me, and that registered with my immune system. The anesthesiologist also set in motion a chain of events that ultimately saved the healthcare system time and resources. At the critical moment when the tube was being inserted, the anesthesiologist patted me on the head and said, "You're really motivated." Under such circumstances, positive words penetrate deeply. Even though others at the hospital told me I would not be able to drain the lung on my own. Within several weeks, I asked the visiting nurse to discharge me. I marvel still at the positive ripple effect of the anesthesiologist's affirmation. Not only was I able to drain my lung in my privacy, affording me time to meditate on healing, but because of this doctor's caring affirmation, a visiting nurse was freed up to attend to patients in greater need. Still another way to offer empathy is to offer respect. Early in my treatment, I shared my practice of envisioning with one of my doctors when I learned I would be commencing targeted therapy. I described how when I swallowed the pill, I would picture a healing light entering my body, surrounding the tumor and the metastasis. In retrospect, I can smile along with the medical community at how strange these words must have sounded in the setting of a hospital. The doctor shrugged, almost indifferently, and said, "What the hell?" Although I smile now, I admit at the time I cringed. Cringing is not ideal for any patient. It evokes the stress response. As the body undergoes stress, chemicals are secreted into the body, causing inflammation and impeding the function of natural killer cells. The stress response is the antithesis of a condition that is optimal for healing. I left the appointment not as I should have, joyful that I would be commencing targeted therapy, but estranged from one of my doctors. Fortuitously, directly after that encounter, I had a second encounter. This was a post-operative appointment during which a surgeon observed that my tumor had decreased slightly in size even prior to starting chemotherapy. I remember how I physically felt hearing that information, a welling up of relief and joy that was purely energizing. I also felt, in looking at the scan and seeing the tumor, that I was being included in treatment. Almost to myself, I said, "I've been talking to the tumor, asking it to get smaller." Again, I knew how strange these words would sound to anyone in the scientific community. But the surgeon's reply conveyed respect. He said, "Whatever you're doing something right. We need to learn from you." When doctors are respectful of their patients' beliefs, patients more easily trust their doctors, confide in their doctors, and perhaps even inadvertently offer clues regarding their symptoms that can allow doctors to offer the most effective treatment. So much goodness flowed from that post-operative appointment. In the weeks since my diagnosis, I had kept my practice active, but I hadn't made any outreach calls. When I got home from the hospital that day, I was so infused with positive energy that I called several clients I hadn't seen. And in a matter of moments, they were scheduled for treatments. There's a ripple effect of empathy that is so powerful it could be scientifically documented. The surgeon's empathy flowed through me, energizing me out into the lives of my clients and into the lives of their loved ones. That's the power of an empathetic encounter.